Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. As always, this is your opportunity to get your COVID questions answered. Today is Tuesday, June 8th, and this is a big week for Chicago because on Friday, that will mark our movement with the rest of the state into phase 5. A big reopening here, and our data from COVID continues to look really good. So we're going to go over data. We've been getting some questions in, and I actually put together a few slides to review some of where we are, help inspire some of you who are concerned about the fact that we're moving ahead with reopening, hopefully, and then obviously take your questions. You can use the hashtag AskDrArwady. You can use that on either Facebook or on Twitter, or you can put them directly into the box below. So with that, let's go ahead and pull up our dashboard. CHI.gov/COVID-. That's always going to be your one-stop shop. So if we pull this up, today is a milestone because for the first time, we have fewer than 100 new cases per day in Chicago on average. Really exciting. That's the lowest that we've been all the way back to the beginning of the pandemic, back in March. And you can see here, 91 cases per day is down 42% from a week ago again. We really are in this stage where we're seeing what we call exponential decay. When an outbreak is growing really quickly, you get this exponential increase at the beginning, but then when an outbreak is coming under control, you'll see this exponential decay because as fewer people get infected, fewer people spread it, you can actually see that drop off pretty significantly, and we are seeing that. You'll see our daily rate here is at 3.4 per 100,000 per day, and that's the same. That means there's about 3 people per 100,000 in Chicago being diagnosed with COVID at this point every day, and that's the same metric that we use for our travel order. That 15 cases per day, we're now at 20% of that, which is really, really good, in very good control. You can see our hospitalizations are at 12 per day. Our deaths are at 4 per day. We're doing about 7,900 vaccinations a day, about 7,500 tests per day. And then our positivity is at 1.6%. Again, the lowest that we've seen really since we've started the COVID outbreak. So that's really exciting news. And if we take a quick look at our vaccination numbers, as this pulls up, I encourage you to explore. You can look by zip code, by age, by gender, by race, ethnicity. We're just pulling that up on the internet there. I'm going to actually switch to a couple of slides that I have here, just so we see where we are. Oops, sorry. Apologies. There we go. So in our risk matrix here, you can see that 3 of the numbers are in our lower risk phase. So we're at 91 cases per day, as I said. Our test positivity is actually under that 2%, which is where we had defined as controlled transmission. Hospital bed numbers are just over 200 as our rolling average, but the daily today is at 160. That is also the lowest we've been since the beginning of the COVID outbreak. And ICU beds occupied by COVID patients, our average is at 72, but also trending down in the 60s today. That is also the lowest that we've been. Our emergency department visits are in that lower risk territory. All the things we're following behind the scenes look good. And if you look at the graph here, you really are able to see visually how much better we're doing, going all the way back to March of 2020. We are definitely seeing that our recent COVID-19 cases are concentrated in less vaccinated Chicago communities and social networks. This is becoming stronger and stronger every week. You can see on the left, the most recent full week, the darker blue are where we were diagnosing more cases. And you can see that particularly on the far south side, we're seeing more cases. And then on the right is the percent of the population, all ages, that's gotten at least a first dose of the COVID-19 vaccine. And again, the darker blue on the right means there's more vaccination. So you can see pretty clearly there on the north side, areas where we've had many fewer cases are where we've had higher vaccination rates, and then vice versa. This is what our test positivity graph looks like, now down to 1.6%. Again, even better than we were doing last summer. And we are seeing that very much across all race ethnicity groups. You can see the drop has been, we're seeing about a third as many cases, even among Black Chicagoans over the month of May, although rates still are highest there, partly because vaccination rates are lowest there. We're seeing that same drop in test positivity across all race ethnicity groups. And if we look, what you see on the left here is in the week ending May 22nd, when we had about 1,700 cases of COVID diagnosed. You can see they're broadly across the city. Already at that point, we're seeing less on the north side, but more on the south and on the west. And then even, the week ending the 22nd to on the right, the week ending the 29th, saw those cases drop to just over 900. Still seeing cases in May in every zip code every week, but you can see those numbers are really retreating. That's on the same scale, making good progress. We are still seeing cases among youth in really every zip code almost every week. This map here shows, except in the central loop area where there are very few children who live, we are diagnosing some cases among 12 to 17-year-olds across the city, again more in the less vaccinated parts. This is what our recent hospitalizations look like. In the month of May, 68% of COVID hospitalizations were in Black Chicagoans. And here's what our hospitalizations look like, this average of 12 new COVID hospitalizations, the lowest since the pandemic began. This is really exciting because these are the patients who are the most likely to go on to develop severe outcomes or to die. And then our deaths, we're still averaging 4 per day. That's still a little higher. Last summer we got down to 2 to 3, but that will continue to decrease as we are seeing fewer people getting admitted to the hospital. There's still, I believe, 37 people who are on ventilators with COVID in Chicago hospitals. That is obviously the most severe when someone is seriously ill with COVID. But I do expect probably over the next few weeks that number of deaths to trend down. And here is, if we look from late March to late May, also seeing that concentration of deaths really on the south side. And our, in skilled nursing facilities where the vaccine uptake has been really good, we've showed this before, but the news continues to be good. This is showing all of the cases diagnosed with COVID since the beginning of June. And as we move forward, since the beginning of September, on the left here, and then now running through the beginning of June. And we've had about 1,700 cases in healthcare workers and about 1,900 cases in residents over that time. But 71% of our skilled nursing facilities are now out of the outbreak, and more than half have gone at least a month without a case. And you can see on these red arrows here, as the vaccine clinics were rolling in, we saw really the outbreak broadly come under control. There had only been one COVID-related death in skilled nursing facility related cases in the past 3 weeks. That's down from hundreds and hundreds earlier on. And we estimate about 88% of residents in skilled nursing facilities in Chicago have been vaccinated, and about 62% of staff. And we do continue to see the majority, by far, of the cases in people who are not vaccinated. We are still seeing some severe outcomes in the month of May. Age is our biggest risk factor. So we had 23 deaths in May alone of Chicagoans under the age of 50. We had another 63 COVID deaths of people in their 50s and 60s. And then we had 96 COVID deaths in people age 70 or over just in May, despite that being the most vaccinated group. But there are still a lot of people over 70 who are not yet vaccinated. And since mid-January, 97% of our COVID hospitalizations and 98% of our COVID deaths in Chicago have been in people who were not fully vaccinated. So the vaccine is working really well in the real world, including here in Chicago. And the reason we're seeing these big improvements is primarily due to good vaccine uptake. We'd gotten some questions about wastewater and what were we doing with being able to track COVID and wastewater, sewage in Chicago. And so I brought just a little bit of information there. There's something called PCAN, the Chicago Prototype Coronavirus Assessment Network node. And as you can see, this is a combination of the Metropolitan Water Reclamation District, multiple researchers, Department of Public Health, Argonne National Labs. And the goal here is to create a Chicago-based wastewater surveillance system for SARS-CoV-2. So when people are flushing the toilet and their waste is going into the sewage, you actually are able to follow at a population level COVID numbers. You collect these composite samples, it's non-invasive, it's very cost effective. It helps you assess at a community level the potential community spread of COVID, and it lets us potentially see emerging hotspots up to a week earlier than we can see them with traditional tests. There's some thought of being able to have a more long-term early warning system. And we're still in the early stages of developing this, but it's something the department has been interested in for a long time, and thanks to the partners. And so the way this works is there's weekly sampling that's happening from 3 water treatment plants, one north, one middle, one south in Chicago, and then some more specific sewer sampling to also look at a more local level. For example, at O'Hare or near the jail. Again, there's a lot of work happening with computers here to decide how best to do this. But as we pull this together, we'll be integrating this data with state and with national efforts, and we'll be sharing more really in the time to come. We're still getting questions, what will we be doing to monitor this moving forward? And certainly testing will continue, but a lot of this higher level really epidemiology and the ability to do data monitoring without needing individual people to change their behavior is important for having new and better ways to monitor. If we look at our vaccination rates by race ethnicity, this is from a few days ago, but 52% at that point of Chicagoans of all ages have gotten a first dose of vaccine. But we are seeing some race ethnic breakdown there. About 58% of both white and Asian Chicagoans, 44% of Latinx Chicagoans, and 35% of Black Chicagoans of all ages have gotten at least that first dose. And if we just limit it to adults, those over 18, we're at 64%. That's really the same. We've been just above the national figure there. But again, we see some breakdown there by race and ethnicity, where white and Asian Chicagoans a little higher, Latinx Chicagoans at 58%, and then 43% of Black non-Latinx Chicagoans. And if we look at that goal of trying to get to 70% of adults having gotten at least a first dose, what this graph shows on the left in blue are males, and on the orange in right are females. And the bars grow outwards. And so the green marks 70%, and on the right you can see the orange bars that extend past that green, where almost all of the age group of women here in Chicago who are at least 50 have gotten that first dose. More than 70% of them have, and the men in the 50s and 60s have. But you can see we still have a ways to go among our oldest Chicagoan residents, particularly those over 85. And then as the population gets younger, we have lower percentages with coverage. Last week, certainly a lot of our focus, of course, then remains on less vaccinated parts of Chicago, and 67% of our first doses went to Black and Latinx Chicagoans last week. We've had a goal that the majority would every week, and that's been good to see. Here is what our vaccine coverage looks like by zip code. We've got one zip code, Englewood, that is still at about 30%, and then increasing from there, getting darker blue as we have higher coverage. And then if we look by seniors, you can see there's better coverage broadly across seniors, but still certainly a ways to go. And then for our hyperlocal work, we actually look at this not just by zip code, but by census tract. So you can see on the left here, this is showing by census tract, which is smaller than a zip code, how many cases we've seen, within the 2-week period, and then on the right, what the vaccine coverage. And so the teams on the ground use this information as we direct resources for both cases and vaccine. And so we've talked a lot about our Protect Chicago Homebound or At Home program. As a reminder, you can call 312-746-4835, schedule a free home-based vaccine appointment for any Chicago resident who is 65 or older, has a disability, otherwise is having a challenge to getting vaccinated, and the team will bring vaccine for any other household residents or caregivers. You can see we've been doing this since there was snow on the ground, but if we look, there have been more than 2,500 doses, and you can see people have really called from across the city, including a lot on the south side where a lot of our hospitalizations and deaths and recent cases have been clustered. So we've been pleased to see that, but if you know anybody who is needing that Protect Chicago at Home home, please call. We're still getting 400 to 500 calls a day, not all for the at-home program, but we've got doses available and we want to get you scheduled. Since I was last on Facebook, we announced the Block by Block community canvassing, which is the effort where we're going knocking on every door is the goal in our 13 least vaccinated communities. Huge shout out of thanks to the many community-based organizations, to the aldermen's offices. In some cases, these are through contracts. In some cases, these are volunteers. We've also moved our contact tracing corps. Some of those folks who have been supporting vaccine in all kinds of ways are now doing this canvassing, going out, answering questions, making appointments for vaccine on the spot, signing people up for vaccine at home. We also, over the weekend, had some vaccine events with Vax and Relax at barbershops, certainly doing some incentive work with our Six Flags tickets available for free at any of the City of Chicago vaccine sites. The Protect Chicago Music Series is ongoing. And so just as a reminder, anybody over the age of 12 in Chicago, you can walk in, you can make an appointment, zocdoc.com/vaccine, or you can call the number. So that was a lot of data, but I wanted to hit a number of the questions that were all coming up at once, and thanks for your attention. So with that, we will transition, if I can get my computer. Into some of your questions. Okay, so we've got a question. Andy J. Silberman on Facebook. Is riding public transportation safe now? Can COVID-19 germs be picked up and transferred from public transportation and transmitted to other people? So, riding public transportation, certainly with our COVID numbers at the lowest that they've been since March, if you are vaccinated especially, I absolutely consider it safe to do. I took the L to work this morning. There continues to be relatively low numbers of people often when I'm on the train or I'm on the bus, so there is a space to distance. The CTA continues to require masking on all public transit. That is a federal requirement. So everybody's wearing a mask. The CTA has done a lot of cleaning and has been running the L and the buses continuously throughout the pandemic. I believe we were the only large city in the US that did not cut the subway service. Even in New York, they weren't running 24-hour subway service during part of the pandemic. But here, the CTA kept things running so that there would continue to be the ability for social distancing. And then now with vaccine here, if you are fully vaccinated and you're wearing a mask, I really have very little concern. And the issue of can COVID germs be picked up and transferred and transmitted, the risk of that is really much lower. What we've talked about all along is that, even if you were to touch a surface where somebody has sneezed, for example, or coughed, and even if they had COVID, you then would need to touch your nose or your mouth to even get those germs potentially into your body. And so I think, you could do some hand washing or use hand sanitizer if you like, sort of as an extra piece of protection as you're getting off the L or off the bus. But broadly, that is not the primary way. Our main concern is about living, breathing Chicagoans, and if you are fully vaccinated, your risk is very low. And I just want to highlight that we are doing some additional vaccination at CTA stops. Our vaccination station, our Vax bus, is going to be at CTA 3 to 6:30. For example, on Friday, we're going to be at the Kimball Brown line, we're going to be at the Pulaski Orange line, the Central Green line, we're going to be at 63rd on the Green line and 89th on the Red line. We've already been at 95th at the end of the Red line, set up to try to get people as they're coming home from work. And certainly we're welcoming a lot of people back into their offices. At the health department, we do have people back. A lot of people have been working in person throughout the pandemic, but we do have people back at least 4 days a week now. And things are going well. From an office perspective, obviously we have a very highly vaccinated population, but most of my staff is taking public transportation to and from work, and I would encourage you to do the same. Son of a Lorax on Twitter is asking, have there been any documented cases of the Delta variant in Chicago or Illinois yet? Are there projections for if or when the Delta variant will become the dominant variant in the country? So yes, there have been, but let me take a quick step back in case not everybody knows what we mean by Delta variant there. So Just recently, the WHO made a decision to use the Greek alphabet system for naming these variants, because it's been hard for people to use some of the more detailed variant names because they have names like B117 or P1. And so typically we've been referring to them as wherever they were first detected. But that has the potential for stigma, because if there is a country, for example, that is doing a very good job of detecting variants, it might be the first to detect a variant without actually having been the place where it emerged. And so, for example, the B117 variant, which is now the predominant COVID, it's the predominant type of COVID virus here in Chicago and across the country. It has replaced the original, the OG, if you will, COVID virus. That one, the B117, because it was the first variant of concern, was renamed Alpha. So that was the one that originally came out in the UK. And there have been 4 at this point that have been named variants of concern. WHO will name first a variant of interest if we're seeing it and monitoring it, and then a variant of concern if it looks like it's more transmissible, if there's any concern that the vaccine may not be protective against it, if it makes people sicker, makes it more likely for them to be in the hospital. And so with all of that background, the Delta is the one that has emerged in India, but we're just going to call it the Delta virus moving forward. And there have been cases of it detected here in Chicago, I believe 12 when we had last looked, and across the US. But the good news has been, again, as a reminder, all 3 of our existing authorized COVID vaccines in the US continue to be broadly protective against all of the known variants. And so we are doing a lot of monitoring for variants. Anytime we diagnose anybody with what's called a breakthrough infection, if somebody has been vaccinated but they develop COVID, we look to try to do some analysis there to see, do they have a variant? Is there anything of concern there? Similarly, if somebody is diagnosed with COVID a second time, quite removed from the first time, we look to see, is that a potential new variant? And the good news is at this point, we've not seen concerns with variants making people significantly sicker here, or the Delta one being very widespread. But they're here. The variants are absolutely here. And we are working, including with some of our modeling partners, to try to look at what might we project out as additional variants are in place. So certainly some more to come there, but we do report out each week as part, with Illinois around our numbers here. But one of the variants, the B117, is already the predominant strain that we're seeing here in Chicago. Okay. All right, multiple questions. Alexandria Dean on Facebook is saying, a bunch of my friends are getting colds right now. Are you seeing or expecting an increase in colds as we reopen more and people take off their masks? So that's a really interesting question. One is just as a reminder, I want to remind folks that still right now, if you're developing new symptoms, even if you think it's a cold, get a COVID test. I had a pretty bad cold a couple of weeks ago. I really wasn't feeling great. I was feeling run down. I was able to get an at-home COVID test. I even got it through DoorDash and was able to get a result on the spot, partly for my own peace of mind. But broadly, I do think, we've seen such different patterns of all of the other viruses because of the masking and the distancing that I do think we are going to see some reemergence. Summer is not typically cold season anyway, but we have seen many, many fewer other viral infections throughout this whole time. We've seen children be much, much less likely to get a lot of the typical viral infections that they get. And so I think in general, as people do stop wearing masks, perhaps stop being so careful about hand washing, we probably will see some of the other viruses for which we do not vaccinate that are less, don't put people in the hospital and don't significantly cause death. We may see increases of that. And it's certainly something that we'll be paying attention to. And there's surveillance, meaning data monitoring, set up really across the country to be following this. Influenza, of course, is the main one that we have concerns about there. With all of the masking and distancing we were doing, as well as pretty good vaccine uptake last fall, we had almost a non-existent influenza season here in Chicago, which was good because with the COVID surge, if we'd had a big influenza surge on top of that, we could have had trouble with the hospitals. And it'll be interesting when we get into flu season and more of the typical cold and flu season that comes in the fall and winter to see how that behaves. The southern hemisphere is on the opposite. They have summer when we have winter and vice versa. So there's a lot of interest in what some of their influenza and their other cold and flu season looks like during our summer to help predict some of what happens in the winter. OK on Twitter is asking, is the COVID census tract level data publicly available? If so, where? And thank you. So we typically, we update our dashboard, as you know, at the zip code level every day. The census tract level data, we more update on a weekly basis, and we primarily use it to drive operations. We will post the slides that I just shared on Facebook, and we do make those available to community members, et cetera. I think if there's significant interest in this, we certainly can post them some more. But we do share them out with all of the community-based organizations, all of the people who are working on vaccine here on the ground. So we'll post today's slides, and then we can continue to post those as interest, but they only get updated once a week instead of daily. Okay, Scott Cowan on Facebook says, my fear is when Chicago opens fully up, there will be another huge wave. How realistic are my fears? And Scott says, P.S. I'm fully vaccinated, but could you also remind people why wearing a mask can still be helpful? So here's where we are. We have been turning that dial pretty aggressively over these last few weeks. And the time to turn that dial for reopening is best done when you are on a decline. And we have continued to see that improvement even being on that decline. And so when we are at 3 cases per 100,000 per day, when all of these hospitalizations, deaths, everything is really at the lowest rate. Deaths are not yet at the lowest, but everything else is at the lowest that we've been since COVID got here and dropping. And we're not seeing any area of the city that is significantly out of control, although there still are some lagging on vaccination. This is the time to open. And for me, the 2 big things are, is there any threat to your healthcare system, and do you have a vaccine widely available? There is no threat to the healthcare system right now. We're averaging fewer than 200 people across the entire city hospitalized with COVID, and a vaccine is very widely and freely available. And if you have to choose between a vaccine or a mask, you'll take the vaccine really every time in terms of that protection broadly. Masks remain recommended for people who are not fully vaccinated, who are not 2 weeks post that second dose. Especially if you're going to be inside, and they do work together. So we're getting a lot of questions in still from people who continue to have concerns and who are going to continue to wear masks. And I support people who want to continue to wear masks. As you know, they are still required in particularly vulnerable settings like hospitals, some of our congregate living settings. They remain required in schools. They remain required in public transportation. And then we're going to see, particularly as we move ahead into next week, there are absolutely going to be businesses and settings and workplaces that decide to continue having masking in place. And that may be if they know that their own staff are not fully vaccinated or they want to limit risk. And that is something that we are in supportive where they decide to do, but there is not going to be a requirement in place outside of those more specific settings. So I feel very good about at least this part of summer. All of the modeling and the projections looks good, sort of over the next couple of months, most likely. We're not done with COVID. There continues to be problems around the world, and vaccine is not going very quickly when we look at the global level, and travel is happening. But I'm more concerned about what could happen more in the fall, potentially, than I am about the next few months. And we should absolutely be open while it is safe from an epidemiologic perspective to be open. And I believe that it is. So that's why we're moving ahead. And I think, I don't know what the fall or the winter are going to bring. I do know that if COVID does resurge, we will see it in communities and social networks that are unvaccinated, and that's why we're continuing to work hard to get folks vaccinated. John Special on Facebook is asking, how long will testing sites remain open, and will they be used differently as time goes by? Yeah, that's a really good question. So we continue to operate, some of the community-based testing. All along, we've been looking at, are there places geographically. Every week we look and say, are there places where we might be having a localized outbreak where there may need to be additional mobile testing, and making sure that that's available. But testing is also very, very widely available through doctors' offices, through hospitals, through labs. You can, like I said, even get a COVID test now at home. Just for I think it's $23.99. You can get it at CVS or Walgreens. You can get it at Walmart. You can order it. So testing availability is definitely increasing. And how will they be used differently? I think we are going to see more testing, I think, similar to what we've been doing all along in some of our more vulnerable settings. So, I could imagine situations where if people are not vaccinated, they may be required to test frequently or even every day, for example. We will have a lot of testing available in schools, recognizing that children broadly are still, the younger children, at least under 12, still are not likely to have had the opportunity to be vaccinated when we will be back in school in person in the fall, and wanting to make sure that testing is a part of that. We already, do a lot of testing, asymptomatic staff, and we have widespread testing available in both public and private schools. But more of that is likely to come, and I think we'll be seeing more of this routine kind of testing while continuing to remind people that if they have symptoms, they need to get a test. Allie Tierney Halverson on Facebook says, we'd like to test our young kids before seeing our vaccinated but vulnerable grandparents. Is there an at-home test that is best for this purpose? Yeah, good question, Allie. So again, the most important thing is those grandparents are vaccinated, which is great. I hope you or any other adults are also vaccinated, but it sounds like the children aren't. So I think those over-the-counter tests are very appropriate for that purpose. You can buy them online. You can buy them at any of the pharmacies. They are approved for kids, and they're just, all you do is, there's a Q-tip and you insert it. It's not at the deep into the nose. You put it in the nostril, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. It comes with some liquid. You put it in a card, and it's like a pregnancy test. It shows you with lines whether or not it's positive. So I would recommend that, probably just as the very easiest. Obviously, you're welcome to use any of the routes, but I do think some of that at-home testing is very good and convenient for settings just like that. And follow up here, any updates on vaccinations for kids under 12? So there was a little bit of news out from Pfizer actually about the dosing, that they are using lower doses of the COVID vaccine for children, and it sounds like they're actually using two different doses. So already for the, I believe, 5 to 11-year-olds, they're using a dose that's about a third of what adolescents and adults have gotten, those over 12, and then they've got an even smaller dose that's being studied for the youngest children. And my understanding is they're expanding their study all the way down to 6 months. Moderna is also very much in the middle of study studies that go down to those youngest kids. And we'll see, right? You can't rush the studies. You've got to make sure all the safety and efficacy data is good. As a reminder, in the adolescent trial, the 12 to 17-year-old for the Pfizer, in the trial, in the arm, meaning the group that got the real vaccine, they actually did not diagnose any COVID cases, compared to in the arm that got the dummy vaccine, there were 16 cases, and very similar in terms of side effects to what had been seen in the 18 to 25-year-olds, which is part of why it was approved. So for those younger kids, they'll be looking at similar, they'll be looking at efficacy, they'll be looking obviously at safety and levels, and I think you can actually, I know they've been enrolling young children, and there was a lot of interest here in Chicago to get kids enrolled in some of those trials. So I still anticipate probably fall would be the earliest that we would expect to have data for kids under 12. Namrata Badra on Facebook is asking, is Chicago following CDC summer camp guidelines, or are they modified based on our local positivity and case rates? Yeah, so we are following CDC summer guidelines. And the guidelines are really exactly that. As we move into phase 5, there is really going to be very little in the way of orders, legal requirements, except in some of these settings primarily that have been set federally. But we have been recommending the same best practices that the CDC is continuing to recommend. And with our local positivity and case rates where they are, really the concern is just that the children broadly have not been able to be vaccinated. So we are following CDC guidance there. Let's see. So a couple of questions here about on Twitter. Courtney Connolly, Dr. Shaw, wondering about students and sort of back to school. Question about why are students still in masks in school or in sports? How can schools reopen when variants are on the rise? So, the plan for reopening in the fall is largely around the fact that even before we had vaccine available, schools were not and have not been the site of significant spread in terms of outbreaks, because we've had that good masking, et cetera, in place. With vaccines very widely available, obviously for staff and for older students, and then we anticipate them coming available in the fall, that is only going to increase. But we've not been seeing outbreaks in schools in recent weeks either, and we've continued to see even the diagnosed cases where we're testing people asymptomatically go down without the sign of spread. So remain confident about that. But the masks are required because, again, masks remain recommended indoors for people who are unvaccinated, and many children remain unvaccinated. Okay, so I think we are just about at time here. A couple things I didn't get here to around how are we working to get the far south of Chicago vaccinated. So if people are not aware, I'll refer you to chicago.gov. /coronavirus is always our one-stop shop. But in the vaccine in particular, there's a Vax calendar. We've got, I believe, 42 events this week alone, just that the city of Chicago is doing, many of which are focused on the south side. That's also the area where we're doing that door-to-door knocking and working with providers, working with pharmacies, all hands on deck to really try to get some of those areas. The suburbs, what is not the city of Chicago, we are working with Suburban Cook and others, but it is a lot of work to keep pushing all of that vaccine out. Chicago.gov/vaxcalendar is where you can go to see the updated information by geography in the city for where the pop-up types events are. And I know just this week we're at churches, we're at beaches, we're at parks, we're at CPS schools, we're at CTA stops, we're at food pantries, we're at job fairs. There's probably more, but really trying to go to where people are and make it easy for people to get vaccinated. And so with that, we will conclude with some good news, and that is that the Mayor's Youth Commission, which is a group of youth aged 14 to 19 across Chicago, is the advisory group for the mayor and for her staff. I've certainly worked with the Youth Commission. They've been very helpful in terms of advising around COVID and outreach to younger people. And so there are some sessions with current members of the Mayor's Youth Commission that are coming up on the 12th and the 19th. And this year, the Youth Commission is going to be focused around public safety, education, public health, and neighborhood development. So if you want to learn more about that, you can Google it, but you can also go to bit.ly/CHIMYCAPP. CHIMYCAPP. The applications are open through June 26th at midnight. Each youth commissioner does get a stipend of up to $500 and venture reimbursements for any meetings and related work that they need to do. So please, I'll go ahead and look up the information about the Youth Commission, and if you know anybody 14 to 19 who would like to help advise the mayor and the city about those issues, we'd love to hear from people. So thank you for tuning in. If we didn't get to your question, we will try to get to it on Thursday. We will be back at 11 and sharing hopefully a lot more good news as we continue to make really excellent progress against COVID. If you know anybody who's not vaccinated, share that phone number with them, 312-746-4835, especially if you know anybody over 70. Reach out to them, help them just get that vaccine scheduled. We'll literally come to their house at a time that works for them. We'll do J&J or Pfizer vaccine. Just want to get everybody protected so that no matter what comes in the future, we all have to worry about COVID a lot less. Thanks for your time and be safe. We'll see you back on Thursday.